guys, welcome to the scholarly edition of Pathoshore. Usually me and my girls are partying and fist pumping all night long, but in this episode, we're totally going to trick you and teach you about something you probably thought we had no idea about. Today, we're gonna educate you on multiple sclerosis, but before we begin, I totally need a drink. So basically, multiple sclerosis is thought to be an autoimmune and neurodegenerative disorder that occurs in genetically susceptible people. Multiple sclerosis is a disabling disease that totally affects the central nervous system, and the central nervous system contains your brain and spinal cord. Within your central nervous system, there are two types of cells present. There's your glial cells and your neurons. Neurons are highly specialized cells that conduct messages in the form of nerve impulses from one part of the body to another. Neurons will use electrical and chemical signals to transmit information to different areas of the brain, between the brain, and different areas of the nervous system. Basically, how an axon works is dendrites will pick up the message that is being sent out by other neurons. The message then will go to the cell body and be interpreted, and the corresponding action will be sent out through the axon, and around the axon you have a fatty covering called the myelin sheath. The myelin sheath is what increases the transmission of the action potential. In people who have multiple sclerosis, a process called demyelination will occur. Now my girl Mandy, the sweetheart, will explain this process just a little bit better.
Thanks, Flucky, for that wonderful introduction into multiple sclerosis. So, multiple sclerosis is an immune-mediated disease. This means that the body's immune system is overproducing antibodies that are specifically attacking the myelin sheath, or the cells that are producing the myelin sheath. The myelin sheath are the cells that protect our nervous system. When the myelin sheath is damaged, nerves become exposed. This is called demyelination. This is what causes a disconnection between the brain and the rest of the body, such as the organs, muscles, tissues, and cells. So apart from the nervous system, which is one of the main systems affected by multiple sclerosis, as well as the immune system, the endocrine system and the hormones produced in the body are also thought to have a major effect on MS. MS is twice as likely to occur in women than it is in men. And one hormone that they are particularly looking at is the pregnancy hormone, estrol. Women who become pregnant that have multiple sclerosis actually see a major decrease in their symptoms while pregnant. So they've started introducing hormone therapy for women that have multiple sclerosis who aren't pregnant, and they're seeing some of the same results. So some of these hormone therapies are starting to be researched and used for multiple sclerosis patients. Although there is no cure, there is some hope in the idea of managing the symptoms for people suffering from multiple sclerosis. And now we're going to move on to some more information from NWOW, and on to you.
Thanks, Mandy. Okay, I'm NWOW, and today I'm just going to teach you a bit about how multiple sclerosis affects the key concepts. The cell membrane plays a major role in multiple sclerosis. The myelin sheath is actually one big cell membrane that wraps around the axon. As mentioned before, in people with multiple sclerosis, the myelin sheath is attacked and destroyed by the body's immune system. Therefore, the demyelination is actually the destruction of a cell membrane. Although our bodies contain oligodendrocytes which are able to create and repair the myelin sheath, in people with MS, the oligodendrocytes are unable to keep up with the damage. Proteins also play a major role in multiple sclerosis. In people with MS, for some unknown reason, T cells, specifically the CD4 and CD8 proteins, along with B cells, are able to pass through the blood-brain barrier. This causes an inflammatory response which leads to the occurrence of demyelination. The MHC protein is also an important factor in the MS process. In people with MS, the T cells are unable to recognize the antigen that is displayed by the MHC protein as a self-antigen, and therefore treats it as a foreign invader. When severe demyelination occurs, electrical signals are unable to be sent through the axon. To maintain homeostasis, the body reroutes the electrical signal to another neuron. When the amount of demyelination that occurs in the body is too great, messages to and from the central nervous system are not received, and therefore a homeostatic balance cannot be maintained. As a bonus feature, we've included some information on how vitamin D can be used to prevent and reduce symptoms of MS.